By and large, people prefer to remain in their own homes for as long as possible. But I believe there will always be a role for institutional long-term care, or at least larger group home, some type of care in this way, because of the large amount of need that especially people with advanced dementia have, with all of their basic needs, as well as the very difficult to manage behavioral and psychiatric symptoms that can come along with that disease in particular. When we're talking about the future and how our society needs to help support an aging population, we really need to talk about home and community-based long-term care services and supports. We need to give people care where they want it. Nursing homes, the ones that will survive over the long term in this quality-focused environment, will also need to continue to adapt to be as resident-centered as possible. Nursing homes were built largely on this medical care model, an extension of the hospital, but a nursing home is different from a hospital. If you come from a hospital to do rehab for 14 days and then go home, that's one thing. And you can give up some of the privacy and the control over your day-to-day routine because you're there to rehab and then get home. But if you live in a nursing home and you're going to live there for even years, for the remainder of your life, that environment has to be tailored to support the way you want to live your life. And I love all the programs that encourage the connection to the community as well, and interaction with the community, because that isolation can be one of the most difficult parts of living in a nursing home. And optimistic in our project, we have heard many stories of residents and families who have just appreciated the time our staff has been able to spend with them, especially with the advanced care planning piece. To do advanced care planning, it takes serious time. You need to talk about how things are going now, anticipated prognosis, and it takes 45 minutes, an hour, sometimes longer for some families, especially when multiple family members are involved. And our nurses take that time. So the added attention and time that our staff have been able to spend interacting with patients and families certainly has been noticed by them and appreciated, and it's helped extend what the nursing home staff is able to do. Nurses in the hospital might cover 4 or 5 or 6 patients. Nurses in a nursing home are covering 25 patients, maybe more. So it's a very different nurse to patient ratio, and so having added hands, another set of eyes, provides not just this additional check for clinical care, but also just the ability to spend that time.